So let's start with pediatric care. So the first thing with pediatric care is that a lot of times we will not be doing x-rays, like Dr. Wyatt was saying. As far as the adjustment goes, it is a much more subtle adjustment. It is very, very light pressure. There is not a whole lot of clicking and cracking and popping. Sometimes you will hear an audible cavitation or movement in the joint where that's just air being released, but it is a very light touch.
But also, to that point, very effective.
Yes, very effective.
You can tell that you're influencing the patient or the child, the infant's nervous system,
right,
based off even that light touch and so forth.
Right, and so a lot of times moms and dads will come in and say that, for instance, their 3-month-old is having issues with, GI upset or constipation or a lot of spitting up, and so I'll have Dr. Wyatt look over them. He'll come up with the subluxations in their spine and we'll adjust accordingly. And so a lot of times, if you're having a 3-month-old that's had constipation, many times they'll feel relief almost before they even leave the clinic. I mean, there's times where we hardly can get them off the table, and obviously, that's great for us, and the parents are, relieved and everything. Sometimes it takes a couple repetitious adjustments, especially I will say in the case when there's a reflux or spitting up. Typically, there's you need a couple repetitious adjustments before you start to see a good improvement with that. But other conditions like ear infections and earaches, babies respond really well to for that. So.